We have this disease in which the immune system, instead of protecting us, makes the mistake of attacking our own tissues, as if our own tissues are foreign. That's autoimmunity. And there are many autoimmune diseases: rheumatoid arthritis, juvenile diabetes, lupus, Crohn's disease, many thyroid diseases. But when that autoimmunity is directed against the brain or spinal cord or optic nerves, in the overwhelming majority of cases, it is multiple sclerosis. So we have a disease of autoimmunity in which our immune system is not acting properly. The approach has been, well, if we suppress the immune system, we will reduce autoimmunity. And that really lies behind the principle of almost all the medicines that we have approved. Well, the problem with that is sure, it reduces autoimmunity and gives us those levels of disease control I just showed you, but it also takes away the protection that the immune system provides. And what are we beginning to see? We're beginning to see fatal viral infections of the central nervous system. So there's the medicine called Tisabri, natalizumab. There have been almost 450 people who've developed a devastating disease of the central nervous system that has a 20% mortality rate and hurts everybody. It's called PML. It was previously only seen in patients who are HIV and people who had certain kinds of malignancies or on chemotherapy. It's now a common fear among the MS population. Never had to face that before. Increased risk of herpes infections of the central nervous system, including fatal herpes meningitis and encephalitis. We've seen increased leukemia. We've seen increased lymphoma. We've seen one of the drugs, 35% of people develop new onset autoimmune thyroid disease, and a significant number of those people develop cancer of the thyroid. We've seen a great risk to women who are pregnant. One of these medicines has a greater than 50% spontaneous abortion or miscarriage rate associated with its use, but almost all of them pose some risk during pregnancy. There's an increased risk of liver toxicity, kidney failure, increased risk of hemorrhage with one of these drugs, including fatal cerebral hemorrhage, as well as, ironically, with some of these medicines, increase the risk of a person getting other autoimmune diseases. So we got a problem, right? It's not just an unalloyed, where everything's being done the right way. Maybe we need something different. And as I mentioned to you, the basic strategy has been to prevent autoimmune disease by just suppressing the immune system. But this suppression leaves people vulnerable to attack by external organisms that no longer have a functioning immune system to protect them. So one of the ways of looking at autoimmunity is that it's a failure of something else called autotolerance. It seems to be the opposite. Now, we know autotolerance exists because it turns out that our immune system has the capacity, actually has the propensity to attack every protein in our body. And the reason it doesn't happen is that we have genetically determined processes that prevent that say, no, you will not attack self. And that's called autotolerance. The best example I can give you of autotolerance is pregnancy. A woman is pregnant and she has within her a child in whom half the genes came from the father of this child. And a large number of the chemicals in that child's body are different than the mother's. What's to prevent the immune system from attacking and killing the fetus? Autotolerance. It shuts off the immunity. Yet women don't get more infections and women don't get cancer, so it's not just suppression of the immune system, it's manipulation of the immune system so they are tolerant. Guess what else happens? In women with multiple sclerosis who are pregnant, during the pregnancy, the disease turns off. No more MS. And then after the baby's born, within a month after the baby being born, MS activity begins to return. Isn't that interesting? And isn't it also potentially a clue to future therapy? If we could figure out what it is in pregnant women that produces autotolerance, could we apply that to the treatment of not just MS, but any autoimmune disease? So, it turns out that, again, Autotolerance is regulated by human genes. And if we could use molecules that stimulate those genes, could we create tolerance in a person with multiple sclerosis and in that way combat their autoimmunity? Turns out the human being themselves produces chemicals that stimulate these genes, and maybe they could be used rather than drugs. So I've already told you about this, but now let me tell you about something else. We've known about the pregnancy thing for some time, and it stood to reason, well, if this is going on during pregnancy, let's look at some of the chemicals that are upregulated or are exclusive to pregnancy. And people have done a lot of work looking at various estrogenic and progesterone-based molecules that are more prominent during pregnancy, and all of the studies have been negative. Gigantic disappointment. Well, there's another chemical. It's called relaxin. It's a hormone. Turns out, relaxin got its name because it was discovered that relaxin allowed the uterus to stretch during pregnancy and then dilated to help the cervix dilate during delivery. So it was called relaxin. Well, it turns out relaxin does many more things than just dilate a uterus or dilate a cervix. It turns out it regulates blood vessels and is currently being evaluated for the treatment of heart failure. It may even be useful in a disease called systemic sclerosis in reducing the fibrosis in the tissues that kills these people. But it also turns out it regulates the immune system. It is a promoter of certain genes that regulate the immune system. And relaxin is way upregulated during pregnancy. So one possibility is that this is a molecule that, if not totally responsible, at least contributes to the appearance of autotolerance during pregnancy. If that's so, why can't it be used therapeutically in the treatment of multiple sclerosis? Furthermore, we know that relaxin is extremely safe because it's been used in these other diseases, and people tolerate gigantic doses without any observable ill effects. So, safety, scientific plausibility, and an action that might benefit people who have an autoimmune disease by reestablishing a balance between autotolerance and autoimmunity. Could we use relaxin as a therapeutic agent in multiple sclerosis as well as a host of other autoimmune diseases? That's the question. So I will tell you, and I don't have any more slides, that one of the major directions we are taking our Multiple Sclerosis Center in the next several years is to do some of the work to establish whether or not relaxin can be used as a human molecule for the treatment of multiple sclerosis. We are the only place in the world that is doing this. It's a literature I now follow very closely, which either means that we're very creative or very stupid, and other people know why they don't want to do it. I'd like to think it's the first of those. And we are in the process of developing a laboratory to investigate this molecule further in animals that have experimental multiple sclerosis, as beginning to develop clinical studies to further investigate the plausibility of relaxin as something that is a future therapeutic molecule in this disease. And I'll stop there. Thank you.